Welcome back. You're watching McLaren Port Huron's Today's Health. And in this segment, we're talking about wounds that will not heal with Bill Holmes. Bill is a nurse and the clinical program director at McLaren Port Huron's Wound Healing Center. Bill, welcome to Today's Health.
Thanks for having me today.
Let's start at the real high level. What's a wound healing center?
A wound healing center, in our case, is a clinic inside of the hospital that treats specifically chronic wounds, which are wounds that won't heal greater than 30 days.
Can you give me an overview of our wound healing center?
Our wound healing center is located on the 3rd floor of the Wismer building. We're open between 8 and 4 for appointments Monday through Friday, and of course, no holidays.
Can patients self-refer there? Can they pick up the phone and make an appointment?
Absolutely. We do take referrals from primary care physicians, or patients can call us directly. Our number is 810-989-3330. We can get you set up with an appointment that way.
What types of wounds do you see?
We see every type of wound you can imagine. Anything from a trauma wound to a diabetic foot ulcer or venous insufficiency ulcers. There's all kinds. Even wounds that you can't see that are caused by radiation. We heal those as well.
Wow, that sounds like a pretty amazing place. Can you tell me what a patient might experience when they come to the wound healing center? Is it like a doctor's office visit, or what might it be like?
It's very similar to what a patient would experience at a doctor's office. You'll come and you'll check in, then you'll have a seat and wait. We'll come and get you and take you back into the clinic. We'll do all of the basic stuff that we would do at a physician's office. Take your vital signs, make sure your medications haven't changed, check for any new hospitalizations, things of that nature. And then at that point, we would go ahead and remove any bandages that we've applied from the previous visits. We'd take photographs of the wounds to track the wound healing, both then and after any procedures such as debridements.
Do you see the physician on your first visit?
You will see the physician or provider at every visit. We have both physicians and nurse practitioners in our clinic.
How do patients know that they're getting the best possible wound care when they come to McLaren Port Huron's Wound Healing Center?
Well, as a wound healing center, that is our specialty. You go to a specialist for other things like cardiology or neurology. We're the wound healing specialists. So we have a lot of evidence that's tracked. We partner with Hologics. They're the largest provider of specialty wound healing in the nation. They have approximately 700 hospital-affiliated clinics that see over 300,000 patients a year and heal over 2 million wounds per year. So all of that gives us a tremendous amount of evidence that's constantly used to update our processes so that we're giving the best care possible.
That has to be encouraging for patients. What kind of feedback do you get from them?
We get amazing feedback from patients. We have a lot of patients who come in with wounds that have been existing for a very long time. They start to lose hope that they could never possibly heal. And we send them out the door eventually healed and hopeful for a much more better quality of life in the future.
We talked with Dr. Brooks quite a bit about the different kinds of treatments, and one of the things was the hyperbaric oxygen chamber, which is really, as he said, the really high-end technology. Why would McLaren Port Huron make an investment in this?
The hyperbaric oxygen therapy is one of the things that most excited me about this specialty. We could go deeply into the science behind it, but ultimately it does allow us to heal wounds that otherwise may not heal, usually due to difficulties with perfusion and oxygenation of the wound. Where we concentrate the oxygen and pressurize it, it allows more oxygen to be delivered to the wound, which encourages healing. And it can also stimulate the production of new vessels to deliver more blood and oxygen throughout the time of their healing.
That sounds really amazing. If I'm a patient with a wound, I'm going to say, take me straight to that hyperbaric oxygen chamber. Does every patient use this technology?
No, not all patients would qualify for this, and it's not appropriate in all situations. We track all our patients and evaluate them for hyperbaric oxygen therapy treatment, but we only use the most advanced modalities when they're appropriate. We always start small and we work our way up.
Dr. Brooks was telling me the hyperbaric oxygen chamber is every day.
It is. When you get scheduled for hyperbaric therapy, it is Monday through Friday for approximately 20 to 40 treatments. Those visits generally last about 2 hours between getting in, getting ready, getting you in the chamber, and getting that chamber pressurized, and then bringing you back to a normal atmospheric pressure at the end.
How important is compliance in getting there every day, every day, every day, every day?
Compliance is extremely important to wound healing, and we do everything we can to assist our patients in getting there every day, making sure that they have the appropriate materials to care for their wounds at home in between visits. If you're not taking care of your wound every day, there's a very good chance that it's not going to heal or potentially get worse. It would be just like not taking your heart medicine every day.
Okay, so need to do the care at home, need to keep that weekly appointment. And so any of the modalities that you use, or the treatment regimens, or whatever you call it, protocols, the patient has to be a really important part of that.
Absolutely. Patient buy-in to the plan of care is extremely important, and it's not just about the wound itself, it's about the whole person. For a wound to heal, a person needs to have good nutrition, make sure that they're not doing other things that may contribute to worsening or non-healing of the wound, such as smoking. If they're diabetic, which is very common, keeping the diabetes under control is extremely important for wound healing as well. And not recurring the injury is very important. So if it's on the foot or an area that's constantly has pressure on it, we have modalities that allow us to do what we call offloading, which will help prevent that wound from being re-injured while it's healing.
I can hear that it's really complicated and there's a lot of things to think about. So you have a whole team working there.
We do have a whole team working. We follow clinical program or clinical practice guidelines that are guided by Healogic's 9 essential steps of healing, which address all of the necessities that have to come together for a wound to heal properly.
Is this paid for by most insurances?
Yes, most insurances and Medicaid and Medicare do cover it. We have specialists in our center that take care of all of the insurance pre-authorizations that are necessary and make sure that your treatment's going to be paid for. And if there's anything that won't be covered, we surely let the patient know ahead of time, give them an idea of what any out-of-pocket costs would be so that they're not surprised by that. We want to heal the injury without injuring them financially.
Very important point. Do you have any closing comments for us?
Yes, absolutely. We're the wound healing specialists. Our passion is to help people heal these wounds that they are not able to heal on their own, and we want them to come and see us. So please give us a call, make an appointment, and we can determine if we are the appropriate people to care for your wound.
Thank you so much for joining us today.
Thank you very much.
And thank you for joining us. We've given you a lot of information. If you have any questions about it, you can call us at Health Access. That's 1-800-228-1484. Or you can always go to our website, McLaren.org/PH contact. You know, there is great, reliable health information. Or you can order a copy of this program if you go to our website, and that's McLaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.